So, to bring the data today, I went ahead and I'm going to show my first slide is the our number of deaths so that we can see that these are now coming down a little bit. Hopefully in the information that you have in front of you, you can see this little bit of a slight coming down now finally. You can see it a little bit better here on the death. That shows this little graph that's kind of flattened out. So that's this flattening here at the end. So the national deaths are going down. Of course, here in Palm Beach County, we have been doing very well. And the hospitals are also doing very well. I'll start with that. There's no problems in terms of capacity. Of course, everybody's still short on staff. That's nationally. And I think all the sectors are suffering from people being out sick. So that is still something that we have to be very careful with. Our next slide shows that the entire country is, with the exception of some very small little spots, are actually still under high transmission. I wanted to remind everybody again what high transmission means. Here's the chart of how it gets calculated. What is keeping us so high is the very, very high number of people. In other words, the number of cases, new cases per 100,000. And that has to be under 100 in order to go down to the next level, which is substantial, and then moderate, under 50, and then finally, when we get to low, under 10 per 100,000. So we're nowhere near that yet. Hopefully, I believe that we may get to that substantial by the end of February to early March. We do have a little glitch with a little data dump. Remember what that data dumps are? When the labs have forgotten or been very busy and they haven't turned their labs in. So right now we got a big dump from a bunch of labs and we have to go through those and take out the duplicates and then count the new number. So we may see a little bump going up in the next few days as we get through those. But it should not be too difficult. By a couple weeks it'll go back down. Our next slide is people are still talking a lot about the variants. The Omicron obviously has taken over at 99.9%. All its babies, remember I called them A1, A2, and A3, all those sub-variants or lineage variants are all part of Omicron. And that is the variant that is causing all the problems with a lot of transmission, very contagious. And so that is what's causing so many people to get sick even over and over again. Here is our data that comes mostly. We always need to thank Ed Chase for putting this together for us. I try to put everything on this one page. We can see that we had the lowest number of vaccinations in the week of January 28th through February 3rd. We only did 1,403. That's the lowest we've had in a long time. Out of that 1,403, our mobile van, the site at Mid-County that's vaccinating, and FAU is doing about 25% of those vaccinations. So we have been not busy the way we were before, but we have definitely continued to vaccinate. We're also working with community partners to be able to, before we go to a site, get those community workers to go out into the community and get people ready for us coming. That has helped us to have more people coming to a site and us being able to do more vaccines. So that's been very, very helpful. We also see here that at this point, the vaccinations with one dose is at 76% for 5-year-old and older. Unfortunately, the number for complete vaccination is down in the 60%. So we still have a long ways to go before we get a little bit more vaccination for a little more protection. We also see that the numbers are going down a little bit slower than they were at the very beginning when it started. So now our number of 100,000 per population is going down by about 200. So in order to get this below 100, it's probably going to take at least 2 or 3 weeks. So I'm hoping by the beginning of March, we'll be able to go down to substantial here to this color. Before we were at moderate, and we want to get all the way down to low. Our positivity is at 15.1. That went down with almost 5 points, so that's going down slowly also. We want to get below 10 to get here to substantial. So again, if that continues to go down, I think we're going to see a little bump, so another couple weeks at least before we get to that 10. And the rest is just data that we continue to look at, make sure how we're doing. This is just to remind you of where we were back in November, that we were at 2.3% with 48 cases per 100,000. That's when we were at moderate. And we want to at least get to that point so that we can be a little more free in the community. I also created, this is a chart that Ed gives to us weekly, and you can just see this is where we were. The yellow line is where we were at moderate back in November. Our numbers started going up a little bit, and then they really started doubling, right? And this is when you put the mask mandate on here around, I think it was around January 4th or so, because the numbers had really gone up very, very high. That helped then to the numbers go down a little bit, and we're at that 300 mark right now. So still high transmission, people need to be careful. And like I said, if we continue going down the way it's going, you can see it's going down by about 200 or so, we should be there into March, at least to substantial, and then we'll drop to moderate. So that's what I have. If you have any questions for me, I'd be happy to answer them, I mean. Oh.
Thank you, Dr. Alonso. And obviously, we're hoping that next few weeks this will continue to trend down. I don't see any lights. I think that everybody is pretty satisfied with that update, and I thank you so much for that.
Thank you so much.